Hi, everyone. Now let's talk about B cell immunity or humoral immunity. So with B cell immunity, it's similar to humoral immunity or to the T cell immunity and the fact that you're going to have two stimulations. But with B cells, they are going to directly attack the pathogen. And since B cells themselves are phagocytic cells and they're antigen presenting cells, they're going to attack the antigen. They're going to then engulf the antigen and phagocytize that antigen. Once they've done that, they can get co-stimulated by, so they can then present that antigen on the surface of their cell with an MHC class 2 protein. And then they can get co-activated or co-stimulated by the helper T cells. When the helper T cells bind, they release interleukin 4, which stimulates B cell activation. And so when B cells get activated, they produce plasma cells. When T cells get activated, they produce the cytotoxic T cells. With B cells, they produce plasma cells. And then they also produce clones of themselves. They also produce clones called memory cells. That's what I want to say. So here we have a B cell, and here is a B cell receptor associated with some antigen. So this B cell has been activated. Here we have a helper T cell that binds to the MHC class 2. As soon as that binding occurs, the T cell releases interleukin 4. Interleukin 4 co-stimulates the B cell, and the B cell is now ready to proliferate and differentiate. And so it does so by producing plasma cells. So it produces identical copies of plasma cells, and these plasma cells produce millions upon millions of antibodies. The other B cells become memory cells, and they remember that pathogen, and they can respond very rapidly. Plasma cells only live for a very short period of time. Within 24 to 48 hours, they die. They work so hard, they work nonstop that they can't have a long life. Memory cells can live for years. And so here we see an antigen. The B cell binds the antigen. That binding activates the B cell. And we have the second or co-stimulation of the B cell. And the B cell is then going to start producing clones of itself. Or clones of plasma cells. So we have all these plasma cells that are being produced, and we have memory cells that are remembered. So the second time a B cell the second time that same pathogen comes in, the memory cell immediately produces the plasma cells, doesn't have to get a second stimulation, it's already ready, and more memory cells are produced. So antibodies come in 5 different classes. All of these classes have that same Y-shaped protein structure. So here we have IgM, here we have IgG, here we have IgA, here's IgE, and here's IgD. And so you look down here, you'll see what their major function is. IgM functions at fixing complement, which is one activity that helps us in producing, or it's one activity that helps us in producing a response to pathogens, is that complement fixation. IgG is the most common antibody. It is the most common secondary response antibody. It also fixes complement. IgA is an antibody produced in our tears, saliva, and in colostrum, which is that first primary milk that babies get. IgE is an antibody associated with um, allergies and parasites. So you're going to see IgE released when you have severe allergic reactions. And then IgD is what we see on the surface of our B cell receptors. So what is the function of your antibodies? Antibodies immobilize antigens. They don't kill antigens. They can't kill them. They just bind. They're proteins. They bind. And in binding, they eliminate the effect that those pathogens can have. So they'll bind to viruses or bacteria or toxins. And this is termed humoral immunity. So the binding causes neutralization. If you have binding on a virus, then that virus is no longer able to do its job, which then causes the body to be able to recover from a sickness. Agglutination, when the antibody binds to foreign cells like pathogens and causes them to clump up. This makes them much more able to be killed off by phagocytes. And then precipitation, this occurs when you have molecules that are dissolved in, say, blood plasma or in the lymphatic tissue, or in the lymphatic fluid, I should say. When the antibodies bind, they make them become insoluble, so they come out of the solution, and then again, they're able to be eaten by those phagocytic cells. So we talk about the immune system and how awesome it is at killing off pathogens, but I also mentioned that it takes time. So when you have an illness, your non-specific defenses are going to come and out directly and start trying to get rid of that pathogen. Your immune system takes time. So it takes a week or two before the immune system really gets that army ready for and can attack. It's because it doesn't recognize initially the pathogen. It takes a little bit of time between the time that it was exposed to the time that the lymphocytes have produced a large enough army to kill off the pathogen. But it also produces memory, and that's the important part of your adaptive immunity, is that your immune system adapts, and as soon as it has come in contact with the pathogen, it'll remember that pathogen, and you'll never have to worry about that pathogen again. And so that's the secondary response. When memory cells respond to that same antigen again, they're going to respond so rapidly that you won't even know that you were infected. So just because you've had chickenpox doesn't mean you can't get infected with chickenpox again. Having chickenpox means that you were sick, you were ill, you had the little bumps that caused you itchiness, and then you got over it. But you can come in contact with people that have chickenpox after that, and you're going to get that virus. It's going to go back into your system. But you won't ever have the chickenpox again, because your immune system will immediately, those memory cells will immediately attack the virus and get rid of it before it could cause any harm. So that's what this figure is showing here. Here is like the initial exposure to some pathogen. Let's just say that we inject a pathogen into some organism. The initial response, here's the amount of antibodies. It's going to take time. So let's just say this is day 1, here's day 4 or 5, here's day 7. We're going to take at least a week before we get that really high response. After, if we wait until the infection is gone and then we get reinfected a couple weeks later, that response is going to be hours to maybe a day or so before we even have any symptoms of the disease. We're going to have an immune response, and those antibodies are going to stay in our system for a longer period as well. Here again is the antibody-mediated immunity. Again, if you're watching this, Firefox works the best, but Google Chrome also does work. At least it works on my computer. If you're struggling, come and talk to me because I'm sure I can get it to work on one of the computers at the school, okay? So there are different types. Oh, what just happened? That's not what I wanted. This is just showing the where I got this. Yeah. Okay. There are different types of immunity that we talk about. We have natural immunity and artificial. Natural is something that we acquire through normal experiences, like you get sick and then you have immunity to that sickness. Artificial is something that we purposefully acquire through medical procedures. So you take a vaccine, that would be an example of an artificial immunity. And so with these, you also can have active or passive. No. So active immunity that's natural is getting infected with a pathogen and then becoming immune to that pathogen. So the chicken pox. If you had the chicken pox when you were a kid, you produced a natural active immunity to that infection. If you're younger and you were around when they started giving out the chickenpox vaccine, then you have an artificial immunity against that same pathogen. So passive immunity is something that we pass antibodies on that protect for a short period of time. So natural passive immunity would be like breastfeeding a child and the baby is getting mom's antibodies. Those antibodies are only going to stay in the baby's system for a week or so, and then they're going to eventually break down. So it's a passive immunity that lasts for a short period of time. Another form of passive immunity is artificial, um, really artificial receiving of antibodies. So here we have monoclonal antibodies being given via an IV. This would be something that would happen if you are ill with an infection at a hospital and they're trying to boost your immune system so you can fight off the infection. Maybe they need to boost your immune system so they can then give you a bone marrow transplant or something like that. That would be an example of why they might use this. So now the last thing in this text talks about different disorders, and we have talked a little bit about the severe combined immunodeficiency disease, or at least some of us have talked about it already. This is a type of inherited disorder that affects both B and T lymphocytes. And what happens is in this disorder, you can't produce the B and T lymphocytes. You can't produce those receptors that they're supposed to have. And because of that, those cells don't grow. This ends up killing most individuals unless they get a bone marrow transplant. Prior to the bone marrow transplant, another option was living in a sterile environment. That's how certain individuals were able to survive for a long period of time. This is a short video about one individual who had SCID, and his name was David Vetter. It talks about his life. So he lived until he was 12 years old with this disease. He was the boy in the bubble. Another disorder associated with our immune system is an exaggerated response to an antigen. So if an immune system overacts when there's something that comes in contact, like, peanut allergy or penicillin or pollen. Those are all things that our immune system sometimes responds to when they shouldn't. This can cause certain types of hypersensitivities. The type 1 hypersensitivity or acute hypersensitivity is going to occur very rapidly and it can be very dangerous. So in this form of hypersensitivity, you can have your airways close up. You can end up having your blood pressure drop significantly. And this can lead to anaphylactic shock. An example of a disorder that shows type 1 hypersensitivities is asthma. Another one would be a peanut allergy. Type 2 and 3 are both called subacute hypersensitivities. And so they cause a response within a few hours of coming in contact with something. And so an example would be a blood transfusion, which would be an example of a subacute hypersensitivity. So you get a blood transfusion, but you get the wrong type of blood. Initially, you might start feeling better, but eventually those blood cells are going to start clumping up, and that's going to lead to the transfusion reaction. And that would be an example of a subacute hypersensitivity. Another subacute hypersensitivity is lupus. And so here I have lupus showing here. This is an example of what happens with lupus. With lupus, you have very fatigued body. You can get a butterfly-shaped rash around the eyes. It can cause aches and pains in your joints. It can cause inflammatory response in your lungs or in your heart. It can lead to poor circulation. It's a very painful and very debilitating disorder that can lead to death if not treated. So both of these can lead to death if not treated. And then we have type 4 hypersensitivity. So this is a delayed hypersensitivity, typically occurs anywhere from 1 to 3 days after coming in contact with the potential pathogen. And examples for this is the tuberculosis test. So most of you have had this test where they stick a little bit of tuberculin proteins under the skin, and then they want to see if there's going to be a reaction. So they look to see if there's a response to those antigens. And if there is a response, that means that you have or have in the past been infected with tuberculosis potentially. Another one is poison ivy. So if you ever come in contact with poison ivy, it usually takes a few days until you actually get the poison ivy rash. Oh, I went a little bit fast, didn't I? The last disorder we'll talk about is an acquired immunodeficiency. So this is not one that we are born with. This is one that we get from typically either sharing needles, through sex, through breastfeeding, through blood transfusions. HIV or human immunodeficiency virus is the only virus that can wipe out our entire immune system. All viruses, all pathogens can cause problems with the immune system. I mean, our immune system has to work harder and you get tired, but HIV wipes it out. And the reason it does this is because it attacks the helper T lymphocytes. And helper T lymphocytes are what stimulate both non-specific and our specific defenses. The initial response to the HIV virus is flu-like symptoms, but HIV will get into your cells and will start causing problems. Sometimes it'll lay dormant for a while, but it'll start causing problems years later. And once you have a low enough number of helper T lymphocytes, you are considered to have full-blown AIDS or acquired immunodeficiency syndrome. This is a video that goes into how HIV occurs, not how it occurs, how it affects your cells. So HIV tests that are done are looking for antibodies to HIV. The problem with HIV is that it's a virus, and viruses mutate so rapidly that we're going to produce lots of different antibodies to our HIV, and sometimes you will start treating HIV with one antiviral, and the virus mutates and it no longer is effective. There has been one individual that was cured of HIV, but they do not have a cure for HIV. So I want that to be very understandable. One person has been cured of the disease, but that does not mean that they have a cure for the disease. So this week, you're going to get to go through a lot of lymphatic activities in class. Hopefully you'll enjoy them, but right now you have finished this chapter. I found this. This was on some like Twitter thing where it said little cute memes. And I thought that was just perfect for what we just finished. And this, of course, is SpongeBob, and everybody loves SpongeBob. So you guys have a wonderful day. I'll pull these 3-red puzzle, and then you can start working. Bye.